across the country are now bracing for the impacts, including how it could affect access to vaccines for families who do want to immunize their children. Senator Bill Cassidy, who is a medical doctor, called the decision a mistake. He now says the CDC's acting director should not sign off on the panel's recommendations. Let's talk about this now with Dr. Dimitri Daskalakis. He is a former CDC official who resigned earlier this year over concerns about Secretary Kennedy. Doctor, how are you seeing this recommendation, especially focusing on babies born to hepatitis B negative women? Do women definitively know whether they're carrying Hep B at birth?
Thank you for that question. So I think importantly, women may know their status for hepatitis B. Testing is helpful, but that doesn't mean that that's true for all women who may not actually have access to testing. And more importantly, hepatitis B isn't always transmitted during birth. It is also something that can happen later after birth in the perinatal period because of exposure to people either in a care setting or even household contacts who have hepatitis B. So the bottom line is that though for the most part, a negative test for hepatitis means that the mother doesn't have it, it doesn't mean that the baby is out of the woods from the potential of exposure. So it really doesn't take into account the epidemiology and the biology of hepatitis B and how we know it's transmitted. It's a bad decision.
And so to be clear, the question here too is, say someone has a newborn baby, they want that baby vaccinated. How could you see this interfering with the availability of them getting that vaccination they want?
Yeah, I mean, the good news is the actual vote that they conducted really didn't change very much in terms of coverage and access. It has created some complication because frankly, it's not written well. It's confusing. So really at birth, if somebody wants to give their baby that vaccine, they can. The problem isn't so much the vote, it's that they've created a huge amount of chaos and confusion among providers. It creates anxiety for providers if you have a vaccine that's called shared clinical decision making, because it makes them think that there's something wrong with the vaccine, that there's something risky about it, and that is certainly not the case. The vaccine is exquisitely low risk, and the risks for hepatitis B are really extensive. So in the US, we should have tolerance for 0 or as close to 0 newborns with hepatitis B. And the problem with this is that is not the priority of this advisory committee nor of this recommendation.
So how would you see this changing for parents who go in to a pediatrician? How would you see this changing those conversations that they are having for parents who have newborn babies? How does that change the conversations they're having with doctors about what to give their babies?
Conversations in the pediatric offices now have been made so complicated by this advisory committee for immunization practices and the work that Secretary Kennedy has done to undermine vaccines. So I think what this really means is that the providers are going to be confused and the patients are going to be confused. And very often what confusion means is the wrong medical decision. And so I think that that's what we're looking at. We're looking at confused providers. So my advice is don't listen to ACIP at all. The provider needs to focus on the American Academy of Pediatrics, the Infectious Disease Society of America, AMA, the list goes on of people who are actually giving good advice to providers and to medical staff around what the right thing is to do for vaccines and for kids about hepatitis B. So, unfortunately, this just creates more chaos, and that's really been the theme of this new advisory committee. It's chaotic, and it creates a lot of distrust in vaccines with no scientific basis. If there was something scientifically important that was different, then this would be an interesting conversation. Nothing has changed about the hepatitis B vaccine that we've been using now for decades to drive down cases of hepatitis B in newborns.
It seems Republican Senator Bill Cassidy agrees with much of what you were saying there. What happens to a little baby if they get Hep B?
It's devastating. So if you have a newborn or near newborn who gets infected, 90% of them will go on from that early infection to what's called chronic infection. And that means that they have virus in their blood. And that virus acts as a carcinogen. it actually attacks the liver and it makes the liver sometimes develop cancer or scarring, which is called cirrhosis. Of those 90% of kids that go on to chronic hepatitis B infection, almost 30% of them will die early of the infection. That's not how we do American vaccine policy. So this means that there will be kids that will fall through the cracks and who will infect with hepatitis B and who will go on to liver cancer. This is a cancer preventing vaccine that this advisory committee for immunization practices has tried to destabilize.
Dr. Dimitri Daskalakis, thank you so much for being with us. A lot of parents watching this very carefully. Thanks.
Thank you for having me.
Boris?